Good day to all. We want to share our experience in relation to a problem that we tackled by a simple quality improvement project. My project title, A Quality Improvement Initiative for Reducing Hospital Length of Stay in a Rh negative pregnant woman admitted for anti-D prophylaxis in a tertiary care center. So with a brief background that the administration of injection anti-D is a key part of a antenatal care of a Rh negative pregnant woman between 28 to 34 weeks of gestation. So with this patient group, we had a problem that as a part of our hospital policy, pregnant women are advised admission for receiving prophylactic anti-D injection and thereby leading to their stay in the hospital. So the problem, we analyzed the baseline data in the first week of October. Patients had a prolonged hospital length of stay with a mean duration of 9 hours and 40 minutes, and 30% of these patients absconded due to delay in receiving a timely discharge summary. Now, we need to analyze this. Before doing that, we formed a team and formulated an aim statement of reducing hospital length of stay of Rhd negative pregnant women admitted for receiving anti-D prophylaxis from a baseline average of 9 hours 40 minutes by 50% over a period of 4 weeks. So we did a fishbone analysis and identified the factors which are mainly related to the policy, people, procedure, and place. So as we all know, there is difficulty in changing a policy of the institute and the people's behavior. But if we do certain interventions with regard to the procedure and the place, then we can modify the problem. So in the first PDA cycle, we planned that all admissions for injection anti-D to be done from a fixed room in antenatal OPD, and it was tested by the end of 7 days, and the outcome was that the length of stay reduced by 38%. So we adapted to this and moved ahead. In the second PDA cycle, we planned that instructions to be given regarding admission timing to the pregnant women and on days from Monday to Friday and excluding holidays. Again, we evaluated it after 7 days and analyzed and found that the length of stay reduced by 44%. So even after timely arrangement of the drug, there was delay in giving injection to the patient because the doctor was occupied with other duties. So we moved ahead. In the third PDA cycle, we planned that after indent of the drug, the staff nurse to immediately load the injection and hand it over to the concerned resident so that it can be timely given to the pregnant women without any delay. And it found that there was a 48% reduction in the length of stay. There was a small reason that non-availability of the doctor at the time of changeover time, and there was the reason for not giving the discharge summary. So we corrected that in the last PDA cycle, and it was planned that the same resident doctor who gave injection to the patient was instructed to hand over discharge paper within the next 2 hours, and the type of discharge slip was changed to a small pre-printed one. This led to a 50% reduction in the length of stay and only 1.4% abscond rate because of the timely discharge, which was initially 30% at the time of the beginning of the study. So the results. The primary outcome attained was reduction in the hospital length of stay for this group of patients, and with the secondary reduction in the abscond rate of these women admitted for receiving the anti-D prophylaxis. And it improved patient satisfaction and thereby improving the quality of care. Improving and reducing length of stay, it improves financial, operational, and clinical outcomes by decreasing the cost of care for a patient. And it can also improve outcome by minimizing risk of other hospital-acquired conditions. Lessons learned. Quality improvement projects involve teamwork. Every problem should be analyzed and solutions to be directed towards rectifying contributory factors by making changes in the processes. Hospital leaders can embrace the challenge of reducing length of stay to lower cost and lessen risk for its patient by adopting a systematic, data-driven, and a multi-pronged approach. Thus, simple steps of QI helped us to tackle this problem and achieve a satisfaction for the patient as well as the caregivers. I would like to end my presentation with a quote by Van Gogh that great things are not done by impulse, but by a series of small things brought together. Thank you and stay safe.